for having me from the neighboring School of Population and Public Health. My name is Verena Rossa. I'm a psychiatrist by background. I have an MSc in Population and Public Health here from UBC, and I'm now a PhD student because apparently I can't get enough of school. And in my PhD, what I do is I look at how we can use health implications and the health message to actually strategically and effectively influence environmental policy. So that right there is one case example of what working in the planetary health field might look like. All right, I was once told you should always start with the good news, so here it is. The human population on a global scale is healthier than it has ever been before. We've seen rise in life expectancy and poverty and child mortality. All these really significant measures of a healthy population have been going up or down depending on what it should be doing over the last 50 to 70 years. So that's great. The problem is that that seems to be coming at a price. And the person that is paying that price is our planet. Just as much as you can see human health increase, you can, on a parallel, see the health of the planet is decreasing. So carbon dioxide emissions have been continuously going up, ocean acidification, tropical forest loss, just a very current topic right now with the fires in the Amazon, water use going up, and everything is just really bad. So we're treating humans so they become healthier, but we're treating the planet so it gets sicker. And this is a quote from the landmark report that came out a few years ago that really kind of spearheaded this entire planetary health movement called Safeguarding Human Health in the Anthropocene Epoch, report of the Rockefeller Foundation, and so on planetary health. And they say, so what is the explanation for, this increasing human health versus decreasing health of the planet? And they say, as a commission, we are deeply concerned that the explanation is straightforward and sobering. We have been mortgaging the health of future generations to realize economic and development gains in the present. And when I go back to this slide, you just saw this word, Anthropocene. Has anyone ever heard of that before? Okay, so I'll try and explain. So basically, when we look at the history of Earth, we're talking about these geological times, or geological eras. And usually that was really limited to what's happening on the planet in terms of the geological changes. And now, for the first time ever, we're actually seeing such substantial changes to the planet that are human-driven that we're calling the current geological time that we're in the Anthropocene, so the human time. And I think one of the main topics that we always immediately think of when we think about the health of the planet or environmental issues in general is climate change. And climate change is actually, sadly, only one of the problems or one of the modifications that we have been burdening the planet with. And there are things like increased human population, which has a huge impact, habitat fragmentation and destruction, pollution, resource extraction, and so on. Those are all different kinds of levers that are affecting the health of the planet. Now, so planetary health, you can already tell by how I'm talking about it, the idea is to reduce the health burden to the planet. But the idea is not to reverse the balance and do it at the expense of human welfare and health, right? So one nice little way to describe this is through this book, Donut Economics. It's an amazing read. It's really fun. And Kate Raworth actually says, okay, so there's a balanced existence where everyone can profit, and that everyone meaning every being on this planet and the planet itself. But that's a very vulnerable area that we're moving within, right? So the outer limit would be the ecological ceiling. So if we go beyond that, we're damaging the planet. If we're going beyond or below the inner limit, which is the social foundation, we're damaging ourselves. So the idea would be that we stay within this lighter green space. The reality looks like this. There are several areas of the planetary boundary that have been surpassed to the extreme. And there are several areas within the social foundation where we're just not really successful, right? So when we look at education, peace and justice, social equity, health is getting better, as we've seen, so are many of the other ones as well. But as they're getting better on the inside, the outside is getting worse. And Kate Raworth, an economist, actually says, we need to change what we define as progress. Mainstream economics has told us that we can measure progress with economic growth. But the donut tells us that progress looks like a balance using resources to meet our rights and protecting Earth's life-supporting systems. And who wouldn't want to believe the donut? I mean, all right. So put simply, planetary health is the health of human civilization and the state of the natural system on which it depends. I think that's a very clear, straightforward quote. And as I was talking to Raluca before, there's in the School of Nursing, but also in other schools and departments, there's always this need to categorize new fields, right? So where does this fit now? Where does it come from? Is it global health? Is it its own field? Is it public health? Is it clinical medicine? So this is, I don't know if you can see it, I had to copy pasted it from Howard Frumkin's slides. And he basically says, the initiative came out of the global health field, but it is influenced by a lot of these other important fields and ideas, and it's trying to really bring it all together. So I was recently, the first week of September, at this year's conference, Planetary Health Conference at Stanford University, and just by looking at the posters and who was there, it's such a variety of people, from geoscientists to chemists to nurses to dietitians. I mean, everyone was there, and the conversations and everything were accordingly, right? It was very interdisciplinary, and everyone had this wish in common to improve the health of the planet. So it was very inspiring. So if you ever get the chance to go, I recommend you go. And what Howard Frumkin, I don't know who's familiar with Howard Frumkin. He's the, one of the leading environmental health people of our generation. He wrote a book that's about this big. I guess when you can say that about yourself, then you've made it. I don't know. But he said this is not just an academic exercise. We need planetary health, and this is really what I found at the conference as well. There were politicians there. A lot of people from NGOs and nonprofits, decision makers. It's not just another scientific academic field. We need it because our house is on fire. We face urgent threats to our survival, to the health of human civilization, and to the natural system on which we depend. We need new ways of thinking to guide us to the best solutions. And make no mistake, planetary health is a radically innovative step forward. We will see. And to finish off my talk, before I give some hopefully helpful hands-on ideas of what you can do, I wanted to show this video that I've just found really inspiring. They showed this at the first Planetary Health Conference, and I've never seen anything like it at a scientific research conference, so this already kind of tells you what the idea is.
Fun fact. Planet Earth is 4.5 billion years old. Mankind, about 140,000 years old. Let me put that in perspective. If you condense the Earth's lifespan into 24 hours, that's one full day, then we have been here on this planet for, drum roll please, 3 seconds. 3 seconds. And look what we've done. We have modestly named ourselves Homo sapiens, meaning wise man. But is man really so wise? Smart, yes, and it's good to be smart, but not too smart for your own good. Yes, we have split the atom. Yes, we build clever machines that navigate the universe in search of new homes, but at the same time, those atoms we split created nuclear warfare. In our quest to explore the galaxy, rejects and neglects the home that we have here now, so no, that cannot be wisdom. Wisdom is different. While intelligence speaks, wisdom listens, and we willingly covered our ears to Mother Nature's screams and closed our eyes to all of her help-wanted signs. Wisdom knows that every action has an equal and opposite reaction, so if we were wise, we would not be shocked when we see storms that are stronger than ever before, or more drought, hurricanes, and wildfire than ever before, because there's more pollution than ever before, more carbon, more trees cut down than ever before. At a record pace, we have increased the extinction of animals by 1,000 times the normal rate. What a feat. In the next 10 to 100 years, every beloved animal character in every children's book is predicted to go extinct. Lions gone, rhinos gone, tiger, gorilla, elephant, polar bear gone. In 3 seconds. Species that have been here longer than us will be gone because of us. In this 3 seconds. In an existence shorter than a Vine video, we turn the circle of life into our own personal conveyor belt. Somebody, anybody help. We were given so much, the only planet in this solar system with life. I mean, we are 1 in a million. No, actually, scientifically, we are 1 in a billion, trillion. That's a 1 followed by 33 zeros. And I don't want to get too spiritual, but how are we not a miracle? We are perfectly positioned to the sun so we don't burn, but not too distant so we don't turn to ice. Goldilocks said it best, we are just right. This paradise where we are given medicine from trees, not coincidentally, but because like the song says, we are family. Literally, everything, every species is connected genetically, from the sunflower to the sunfish. And this is what we must recognize before it's too late, because the real crisis is not global warming, environmental destruction, or animal agriculture. It is us. These problems are symptoms of us, byproducts of us. Our inner reflection, loss of connection has created this misdirection. We have forgotten that everything contributes to the perfection of Mother Nature. Corporations keep us unaware and disconnected, but they have underestimated our strength. Contrary to popular belief, millions are waking up out of their sleep, seeing our home being taken right up under our feet. We cannot allow our history to be written by the wicked, greedy, and loony. It is our duty to protect Mother Nature from those who refuse to see her beauty. Call me crazy, but I believe we should have the right to eat food that's safe, with ingredients we can pronounce, drink water that is clean, marvel at trees, breathe air free of toxins. These are natural rights, not things that can be bargained for in Congress. See, they want you to feel powerless, but it has been said that something as small as the flutter of a butterfly's wing can cause a typhoon halfway around the world. Well, when enough people come together, we too will make waves and wash the world into a new era filled with love and connection, freedom for all without oppression. But it is up to you, yes, you watching this behind this screen, to make the effort, because time is of the essence, and only together can we make it to the 4th second.
I've seen this countless times and I still get goosebumps. So just to finish up my talk before I hand over to Raluca, in the video we said together we can make it to the 4th second. So what can you do? What can you as an individual, but also what can the School of Nursing as an institution, as a department do? And there's, so many things, so many levers that can be applied to this. So for instance, do you have a planetary health course in your curriculum? Are these issues at all included in the curriculum at the School of Nursing? What about events? I know this is maybe the first event that is even talking about planetary health. Can that be extended? What about the catering of the events? And I was giving you a warning before. Food is actually the #1 thing, the lowest hanging fruit that all of us can do to improve our own health and the health of the planet. So why not make it a policy at the school to serve only planetary healthy food? Because that's actually good for us too. And I know pizza is delicious, but there is also very good healthy and planetary healthy versions of pizza. And then even further than that, what about your clinical practice? Every time you take off those single-use gloves, where does that go? Just try to be more aware. And then finally, there's a new kind of movement among physicians and other clinicians that have the idea to introduce this kind of work into patient care. And that's actually, there's a long history of health professionals who, by the way, have the highest rate of trust of all professions in North America. There's a long history of those professions to actually take on responsibility for environmental health and the health of the planet. So how can we include that in our everyday work? I'm going to leave it with a question mark there. And finally, why not join the global community of practice? The Planetary Health Alliance is, a large community of very high-level universities, nonprofit organizations, governmental entities. It's free of charge, and you would just get a lot more exposure to this topic. So I'm going to leave it there and hand over to Raluca. And I think we'll have a Q&A at the end. Yeah.
All right. Thanks again, Verena. That was really powerful. Every time I see that video, I tear up. For some reason, I'm very emotional, but it definitely grounds me again in why we're doing this presentation. And I was really happy to be able to put this together and to have Verena and Kelsi join me. And also, I just wanted to give thanks to the School of Nursing for being able to offer this platform to disseminate learnings on planetary health. So back in August, I went to the BC Coalition Institute's workshops. Essentially, it's called an institute, but it's a part of the Canadian Coalition for Global Health Research. And the theme was planetary health. And I went in as a novice, and I speak to you as a novice. So bear with me, because I feel very passionate about climate change and bringing that into nursing education. So I went to this institute with the hopes of exposing myself to better understand what does planetary health mean and how can that shift my research that I'm doing for my final project within the School of Nursing. So just going to cover the key learnings and some recommendations that I have pulled from the Institute, but also from some of the literature that I have received exposure to. And then at the end, and we're more than happy to make these presentations available for you, I've added in some resources inclusive of any associations, organizations, as well as any readings that I found were particularly useful and instrumental to further help support knowledge on this matter. So this quote was spoken by one of the participants at the Institute, and he is an individual who works with city planners and does a lot of urban planning and development, has quite a lot of wealthy knowledge. And I thought it was a very powerful quote because it made me think about how do we actually create paradise in our own communities? How do we define paradise? And I really like this picture I came across on the internet because it speaks to our land and our country. And, I just want you to think about this quote and this picture as I go through the presentation and ponder upon your personal actions as you live. And yeah, sorry. It was very difficult for me to condense it to 4 key learnings. There was a lot of things that I've learned when I attended the Institute in the summer. And I wanted to categorize them in this order because that's of the importance that they held for me. And so I'm going to try to do them justice in the short time that I have and briefly talk about each and every one of them. So the first one, Indigenous sovereignty could save the planet. This is a statement that was spoken by Dr. Shannon Waters, who was actually one of the first people who delivered a presentation on the work that she's doing on Vancouver Island and her very close ties with the Indigenous peoples. And I thought about how for hundreds and hundreds of years, the Indigenous peoples have been living on these lands. We're talking globally, beyond Canada, because there's still groups of people, even in the Amazon, who live autonomously. And the bonds that they've actually historically created with the lands are so sacred to their ways of living and their ways of being. And it resonated with me because I thought, well, what I need to learn from them, how to properly live in a way that's emphasizing on planetary health principles, and that's more sustainable and ecologically and both conscientiously, as well as in a way that's sacred and protecting these natural ecosystems that we have. And I thought about the work that the TRC, we've started doing now in Canada with the TRC. And I believe through this planetary health concept that's been so new and getting so popular, that it's another way through which we should be partnering and building mutual respect with the Indigenous peoples and learn from them on how we can better protect the environment that we're living in. Just thinking back to the amount of human-induced activities that have eroded the ecosystems and hence eroded the way that now their lives, because they're built around the environment, we need to be very conscious that people who live in remote and rural areas depend on these ecosystems. So it's just the first and most important, I think, takeaway for me that I had from the Institute. The second was the inextricable link that planetary health has to human health. And Verena has shown you a few diagrams that touched upon all the factors that play into planetary health. And while I speak from it from a climate change point of view, because that's the area that I'm focusing on, like I mentioned earlier, the human-induced global warming has now caused this changing climate, which has in turn disrupted the ecosystems and hence increased risk factors to human health. Why should we nurses and healthcare providers care about this? Because we work with these patients and we need to start waking up and looking at what's happening in our country. A pure example is the wildfire smoke exposures that have been happening across BC and Alberta. I think we are fortunate enough that this year we didn't actually have it that bad as people say, but that doesn't mean that it's not going to get worse. And there's been increasing research demonstrating that people are attending more emergency room visits for exacerbations in respiratory and cardiovascular conditions. And then we look at flooding and increasing disasters, such as the storm that just happened in the Bahamas, and that just touched the Maritimes. So these are things that are happening right now, and these are intricately linked to how humans are affected, whether they're being displaced or whether their health is being compromised. The next learning was related to education, and there was a lot of nurses who attended this institute, and our group focused on education. And one of the deliverables is actually what we're doing right now is to disseminate the knowledge that we gain, and still so much to gain. But one of the things that we talked about in our nursing group was that we really need to develop guidelines that better implement planetary health concepts and thread them throughout the nursing curricula. And we already do this a lot through social determinants of health, but we need to do a better job to include concepts such as sustainability and how they're related to healthcare. And this also means that we need to provide ongoing professional development to both clinical nurses, leader nurses, policymakers who are nurses, academic professionals, and beyond. So I know that we've done a lot of great work, but we still have a lot left ahead of us. And the last key thing that I took away was, because of the presence of multiple disciplines who participated in this institute, the emphasis on inter and transdisciplinary collaboration was there, because we had transport engineers, urban planners, we had people from public health, lots of nurses, physicians. There was a historian, I believe, as well. So there's people coming together with a shared vision, and we need to try to find the best ways through which we can do the same within our schools and our healthcare institutions. Moving away from us versus them towards we, I put that there because I find that sometimes we tend to work in silos, sometimes especially within even the healthcare professions. So we need to find this common ground, which is our planet, and try to find the best ways forward to be able to engage with one another, which means embracing an open mind and actually being open to shifting our values. So prior to going forward with recommendations, one of the quotes that I read on the Healthcare Without Harm, which is a resource I attach later, is related to the Hippocratic Oath to first do no harm, primum non nocere. So if we are committed to patients to make sure that we deliver safe, quality care, then we should commit equally in making sure that our climate footprint does not compromise this. So we need to be able to account for all our actions, no matter where we practice. And so I just think this really resonated with how the Hippocratic Oath is easily translated into the kind of work and activities we're doing to ensure the safeguarding of our only planet. And so, while there's a lot of recommendations, and please believe me, I'm still going through the literature. It's actually like, it's gained so much momentum that it's actually really hard to keep track of or keep up with. But one of the articles I came across is written by Ann Kurth, and she's from the United States. And she talks to how nurses are not only well positioned, but can undertake the leadership and adaptation efforts. So in management, we have the ability to identify vulnerable populations, to develop and implement emergency plans. And yes, you can do this with a nursing care plan. You just tailor it to the context, for instance, of Planetary Health. You can develop green teams. Green teams, examples for those could be, for instance, if you're doing a collaboration with occupational health and safety committees within the hospital, if you're, for instance, you're concerned about waste management and how you can help your institution decrease its carbon footprint, there's, again, I attached a lot of resources because it's a lot of content. There's simple ways and strategies that you can adopt in your institutions that you can take forward. I've mentioned education earlier, and that also translates to the education that we're providing our families, our patients, our communities. And there's more need for political engagement and policy advocacy within this platform. These are recommendations that I pulled on the individual level, and these are things that I personally committed to. I wasn't sure if perhaps people knew about these organizations, but these are fantastic initiatives that you can do as well in your spare time. While I realize that we all live a very busy life and it's very hard to find any time for relaxation, I like to think of these kind of activities as a way to spend time with my partner and my friends out in the community doing something for the greater good. So, and also at the same time, you're not only giving back to the community and to the planet, but you're also having the time with your family and friends, while maybe probably having really good feelings about the activities that you're undertaking. And the shoreline cleanup, actually, there's a lot that happen in Vancouver. So the website is fantastic. Like, you can lead your own. And so in closing, before I just quickly go through the resources, I wanted to say that we talk about the Sustainable Development Goals. We talk about achieving universal health coverage. And yet now there's a summit, the UN Climate Summit, that's happening in the United States. And we should be waking up to words spoken by, for instance, the young Greta Thunberg, or people who are joining in marches this Friday for climate. Like, I'm not saying go and protest or strike, but I'm saying if you can find ways to participate and raise your awareness and use resources such as these to increase your understanding about why planetary health is so interlinked with human health, then I really think that we have a chance. And these I really recommend. I've subscribed to most of these, and you get a lot of research and up-to-date information. So they're really great places to start. And like I said, we'll share this. And these are just some of the readings that cover some of the content that I've mentioned. And for those of you working in the hospitals, there's some, like I said, really good resources on understanding hospital waste and what can be done through some of the activities you can undertake. And in closing, thank you to the School of Nursing and the Coalition Institute, because it's given me the opportunity to have exposure to this world and meet people like Kelsi and Verena who are joining me today. So thank you.
So, as mentioned, I'm Kelsi, and I'm currently studying at the School of Nursing as well with Raluca. I did my undergraduate degree here as well, like some of you. But prior to that, I did my first degree in animal biology at the University of Guelph. So, unlike my two colleagues, I'm not going to talk about what's being done on a global level, but more what's being done in our community and a One Health movement that you can get involved with here. So before I start my presentation, I just wanted to acknowledge some of the key community sponsors and partners that make this work possible. So Directions Youth Services, where we hold some of our One Health clinics, along with Evelyn Saller Community Center. We have University of British Columbia in the Community Engagement Department, which has funded part of some of our clinics. Pet Smart Charities, which gave us a startup grant, Pause for Hope, Animal Foundation, which has been, the organization has been supplying us with pro bono veterinary care for all our clients, Royal Canin, which donates pet food to each event, the School of Nursing here itself, which supported the pilot project, and to my master's research today, along with CIHR, which is funding my master's research. And also I should give a shout out to Doris Lunn in the back room there, who is my key partner in crime for doing this work. She's a veterinarian and has her master's in public health. So just to give you an outline of my presentation, I'm going to talk about what is the concept of One Health, the charity I work with, what's going on here in Vancouver, and how you can get involved. So One Health, the concept is really the notion that animal, human health, and the environment health are interconnected. They're not separate entities. So the application of this involves a multi-sectorial and interdisciplinary approach where we collaboratively work together to address potential risks at the human, animal, and environmental interface. So how does this work? By designing policies, programs, and research that addresses these issues to improve public health. So the charity I work with is Community Veterinary Outreach, and the group's mandate is to provide pro bono veterinary services to vulnerably housed and low-income individuals, with the goal of then connecting the pet owners to human health care services themselves. So this model began in Ottawa in 2003, and we expanded it here in Vancouver in 2006. We also have clinics in Kelowna, which we had one yesterday, Kansas City in the US, Ottawa, Toronto, Hamilton, Guelph, and the North York region. So as we're all aware, homelessness in Vancouver is not invisible. It's been a social crisis that has continued to rise over the last decade. Being in nursing, I'm sure you're aware of some of the social determinants of health that contribute to homelessness, such as poverty, trauma, and mental health. However, maybe you're less aware that actually 20% of this population identifies as pet owners. According to the 2014 Homeless Youth Survey that was done by the McCreary Report in collaboration with Pause for Hope, 44%? Of youth, street-entrenched youth had a pet. While this is significant, this is actually lower than some of our rural communities in BC. So just to address any misconceptions surrounding the animal health, because one of the questions we often get doing this line of work is, you know, if the person's homeless and they can't take care of themselves, why do they have an animal? Well, actually, it's quite the opposite. Research shows that the animal body condition is actually improved in this population in comparison to house pets that Doris would see in private practice. These pets are better socialized. We have dogs and cats off leashes. Cats are not coming into our clinics that are in carriers in a very small space, and we've never once had any issue. And lastly, there seems to be no real significant difference in chronic disease in this population versus house pets. To address the human health, in this population, we see that pets actually act as a protective factor around issues such as mental health, substance use, anxiety, depression, and suicide ideation. So often in our clinics, we offer harm reduction supplies and naloxone kits, and we'll offer them to our clients. And a response that I hear often is, no, I don't use drugs, I have a pet. So the pet provides some sort of sense of purpose and responsibility, and can act as a catalyst for positive changes. So how is this work done in Vancouver? We have marginalized pet owners that we reach out to, often in Vancouver's downtown east side, or a lot of our student-entrenched youth are on Granville Street, who are companion animals, and we reach them, and then we have their companion animals, and we reach them through a multidisciplinary approach. So how does this work? Well, our clients are referred to our clinics through a referral basis, but we will often accept walk-in clients. The free veterinary care is provided first, where messages of human health are often amplified through this appointment. So services, and then we'll offer parallel human health services. So an example of this would be giving core immunizations to the pet, and then offering influenza vaccines for the people. Another example would be like our pediatric population that has small airways. Cats and dogs have very sensitive airways, so providing some sort of education around the risk of secondary smoke, and then offering NRTs. So this, I just wanted to give you a little bit of a visual how this actually, what this looks like, rather than me just talking about it.
When the public sees people that have animals on the street, their comments to me will be, they can't look after themselves. How can they look after an animal? People who are homeless or vulnerably housed and, at some point in their lives have experienced some sort of trauma. If you're coming from a middle class or upper middle class background, you're not very familiar with how poverty happens, how homelessness happens.
It's scary sometimes because I think that all of us are one or two bad decisions away from being in the place of the person you see in front of you.
What started me doing outreach, I think, initially came out of welfare concern for an animal who was living with someone who could not probably afford veterinary care. For many people, they see people who are on the street or low income or no income as not always being able to care for themselves and not having the means to care for themselves. And so logically think that therefore they would not have the means or capacity to care for something else, such as an animal. One of the common criticisms that I receive as a nurse that deals with street-involved people is when the public sees people that have animals on the street, their comments to me will be, they can't look after themselves. How can they look after an animal? Why should they have animals? They can't care for them. So my comment is to ignore that initial stigmatism and focus on the value that the animal plays in that person's life.
Let me write that.
People who are homeless have not been able to develop relationships because of the transient style of their life, for whatever reason they're there. So when they have the opportunity to have a pet and have that significant person, significant companion in their life, it means the world to them. I've been a veterinarian for 25 years, and I've been doing outreach work for about 8 years with Michelle. And I really enjoy this work because it has given me a lot of insight into the clients we serve and the fact that these clients love their pets as much as anybody else does. And most of them need them more in terms of the relationship. What's happened over the years is that we've started to see that these welfare issues that I had were probably not always founded in reality, and that the animals are, for the most part, very well taken care of. And we've started collecting information and data now on the animals that we've seen over the last 11 years in outreach clinics. And some of the data that we looked at was the body condition score of over 300 pets that we examined for our outreach clinics. What we found was that over 70% of our pets were in ideal body condition score. Now you compare this to the average North American household pets, where we find over 55% of those pets are overweight. These animals are in very good health and welfare, and in fact, in many aspects,
and better health and welfare than some of our housed pets. I think what's really important for all of us to understand who have our health, who have social support, that we're really just very lucky, and that nobody ever plans on being homeless.
If you look at their lives and what they don't have in life and all the losses and crises that they have, the animal actually gives them that little bit of friendship, companionship, that unconditional love, that my animal's always here even though my world sucks and everything's wrong in it. A lot of our clients out can't find that unconditional love in other human beings because trust is gone. The one constant could be that pet. And it's non-judgmental and it's unconditional. These pets often offer the only opportunity for them to experience unconditional love without judgment. Pets are a reason that some of the folks we serve get up in the morning. They're reasons to live, and that's the only reason I need for our clients to have pets. We see that these pets have positive impacts in the lives of their owners. In fact, over half of these said that having a pet had given them a reason to live, and almost half said that having a pet saved their life. How can we say that these people shouldn't have these animals when they're good pet owners, to the best of their ability, and they can have such profound positive impact in the lives of their owners?
Sorry. Oh no. That video sort of gave you a depiction of what the clinics look like in Ottawa. However, our model here looks rather similar. So as I mentioned, the first One Health clinic was done in 2016 here in Vancouver. We have clinics about 4 to 5 times a year, depending on resources. All our clinics are volunteer run. So if you're interested in getting involved, you can do so. So I thought I would end the presentation with a quote from our founder, Michelle Lem, who was depicted there in the video. And she states, "We realize the potential of veterinarians and veterinary care to influence the health and welfare of marginalized people who are pet owners." The opening is the animal.